Assalamu alaikum wa rahmatullahi wa barakatuh. Today we are going to be focusing our attention on our adolescents because we are going to be talking about acne, which is commonly referred to as pimples. Although I must assure you that acne is a lot more than just pimples. Acne is caused by blockade or inflammation of the sebaceous glands. These are the oil-producing glands on the skin, and is found. It can occur in any skin, on any part of the body where these sebaceous glands are present. And that means that it cannot occur on the palms and on the soles because the sebaceous glands are absent there. Now, it's more common in males, although both males and females can have it. And as I said, it's more common in adolescents, although it can occur at any age. It's more common in adolescents because this is when the hormone androgen is being formed in large proportions. And it's also more common on the face, on the anterior chest wall, on the back of the thorax, that's on the back of the trunk, but it can occur elsewhere, as I said earlier. Now, why do we need to talk about acne? It's a common thing, yes, but it's also very distressing to our youth, to our young ones, because hitherto they probably have had very lovely skin, and then all of a sudden they start having these bumps on the face and on the anterior chest wall. So we need to talk about it and let them know that in most instances it's just a passing phase, because as they grow older, most people grow out of this acne. Why do some people have it and some people do not have it? It's genetic. Sometimes you find it in a particular family. When a father has had it in his own youth, the children also have a more propensity to develop acne. Or if it's the mother, it also affects, ensures that more of the children will have it than families that the parents didn't have it. It could also be as a result of a climate. You find that a lot more people are forming less acne where there is a lot of sun, whereas in the cold areas, they may be more predisposed, especially when there is excessive heat or excessive humidity. Now, it could also be as a result of our diets. If a lot of people take chocolate or pig fat in whatever form it comes, it affects our predisposition to forming acne. But you find out that those other things that people attribute to it, groundnuts or fried groundnuts or roasted this or that, have actually nothing to do with acne. But when you have acne, what do? Ensure that your face is properly washed, is kept dry, free of oil. You do not go and start putting oily substances on it again. And there are some astringents that you can use, which you can buy off the counter. As I said earlier, it's mainly in the adolescent age. In most instances, if you don't allow a bacterial infection to be superimposed on it, then you really do not have any need to visit a doctor. But if it is, if you discover that there is some pus in it, then it means that it's been infected and you need medical care. Or if it's there and you're in your 20s and it's not going, or you have this feeling that your skin is really not doing too well, then it's better to see a dermatologist. Assalamu alaikum wa rahmatullahi wa barakatuh.